Diabetes. Does that word scare you? It is said that both genetics and lifestyle play an important part in Indians getting diabetes, and unfortunately that makes India the diabetic capital of the world. You may be aware that diabetes affects almost every organ in the body, including the eyes. Hi, my name is Dr. Deepak Garg, and I will be talking to you today about how diabetes affects the eyes. In the eyes, we basically see two changes, the first being diabetic retinopathy and the second being cataract. Diabetic retinopathy is a blinding disease. It is a problem in which the retina of the eye is damaged because of diabetes. The retina could be compared to the film of a camera, and therefore it's a very important part of the eye. The disease per se can be mild, moderate, severe, or even a very severe disease, and the doctor will treat the condition depending upon the stage at which the eye is. In the initial stages of the disease, the doctor may only inform you that you're beginning to have the disease, that you need to control your blood sugar. In the later stages of the disease, the doctor may use techniques like performing lasers, giving you injections, and of course in very advanced surgeries, in advanced disease, he may even consider performing surgeries. The injections that the doctor administers actually consists of a drug which we call as anti-VEGFs, VEGF. VEGF standing for vascular endothelial growth factor, and these anti-VEGFs prevent formation of new blood vessels in the retina, which actually lead to the complications. It is very, very important to remember that when we treat diabetic retinopathy, we are not really reversing the disease. What we are doing as doctors is we are trying to prevent progression, we are trying to prevent further damage to the retina, and therefore diabetic retinopathy becomes an irreversible blinding condition. It is thus very, very important to prevent diabetic retinopathy, and that can be done by a routine yearly dilated eye examination, wherein the doctor would put some drops in your eye, your pupils would dilate, and he would be able to examine your retina in detail. The second problem that diabetes causes is cataract. Now, you've already heard of cataract. Cataract happens in almost everybody, and one could even call it an age-related change in the eye. It's not really a disease. What happens in diabetics is that you get this cataract a few years earlier, and the cataract that happens in diabetics is very visually disturbing. Cataracts, of course, can be very easily treated by performing a cataract surgery with the implantation of an intraocular lens inside the eye. And therefore, cataract is not something that a diabetic has to worry about. But the first problem that I spoke about, diabetic retinopathy, I will repeat, it is an irreversible condition. So the most important message that I want you to take home after watching this video is to get a routine dilated eye examination once a year, so that your doctor can diagnose diabetic retinopathy as soon as it comes into your eye. The other thing is, of course, to control your blood sugar, and that can be done by routine examinations or consultations with your diabetologist. Remember these 2 points. I do hope that they've added value to your knowledge about diabetes and the eyes. Thank you so much for watching.